Iron deficiency is the commonest nutritional deficiency worldwide, affecting approximately 2 billion people. The prevalence amongst non-cardiac surgical patients ranges from 34% to 60%. The WHO defines anemia as hemoglobin concentration less than 13 grams per deciliter for men, less than 12 for non-pregnant women, and less than 11 grams per deciliter for pregnant women. However, current guidelines are adopting a modified definition of anemia as less than 13 grams per deciliter for both men and women undergoing the same surgical procedure. The most common causes of anemia are chronic blood loss, nutritional deficiencies, and anemia of chronic disease. It is a recognized risk factor for poor postoperative outcomes and contributes to an increased likelihood of perioperative blood transfusion, which itself is associated with higher rates of morbidity and mortality. Therefore, the diagnosis and treatment of anemia and iron deficiency should commence as early as possible in the perioperative period. This audit was retrospective. It was performed in a 560-bed university teaching hospital. All patients who underwent an elective hip and knee replacement over a 3-month period at the end of December 2019 were identified by the review of the hospital system. Their pre- and post-operative hemoglobin levels were recorded, and also any instances of the administration of intraoperative blood transfusions were recorded. In our institution, anemia is defined as less than 13 grams per deciliter for male and less than 11.5 grams per deciliter for females. So this does differ slightly from the WHO. We found that anemia was present in 41.4% of our patients, which equates to 29 of a total 70 over a 3-month period. 4 out of these 29 patients received one or more allogenic blood products during their inpatient stay, which equates to 13.7%. We recognized that there was a relevant drop in hemoglobin levels pre and post-operatively, and we looked closer at this. We identified a total of 23 patients, and this subcategorized into 13 of those 23 had a reduction of more than 3 grams per deciliter. And this highlights the potential blood loss that is significant and is associated with hip and or knee replacement. We conclude that recognition and management of preoperative anemia is suboptimal in our institution. It's clear that it contributes to adverse outcomes. So we aim to introduce a perioperative pathway for the management of patients with anemia that extends from the decision to operate to complete recovery from surgery.